ఈ ఏడాదికి అత్యంత విశ్వసనీయ ఉత్తమ న్యూరోసర్జన్ అవార్డును డాక్టర్ మోహన్ రావు పాటిబండ్ల అందుకున్నారు. డాక్టర్ రావుస్ ఆసుపత్రికి ఉత్తమ న్యూరాలజీ అవార్డును పాటిబండ్ల నారాయణస్వామి న్యూరో సైన్సెస్కు న్యూరో సర్జరీ హాస్పిటల్ అవార్డు వరించింది. ఢిల్లీలో ఈ అవార్డుల ప్రధానోత్సవం గ్రాండ్గా జరిగింది. కేంద్ర మంత్రి రామ్దాస్ అథవాలే, బాలీవుడ్ నటుడు చుంకీ పాండే ఈ అవార్డులను ప్రదానం చేశారు. ఈ కార్యక్రమంలో మంత్రులు పరిషోత్తం రూపాల, ఫగన్ సింగ్ కులస్తే పాల్గొన్నారు. ఈ ఏడాదికి అత్యంత విశ్వసనీయ ఉత్తమ న్యూరోసర్జన్ అవార్డును డాక్టర్ మోహన్ రావు పాటిబండ్ల అందుకున్నారు. డాక్టర్ రావుస్ ఆసుపత్రికి ఉత్తమ న్యూరాలజీ అవార్డును పాటిబండ్ల నారాయణస్వామి న్యూరో సైన్సెస్కు న్యూరో సర్జరీ హాస్పిటల్ అవార్డు వరించింది. ఢిల్లీలో ఈ అవార్డుల ప్రధానోత్సవం గ్రాండ్గా జరిగింది. కేంద్ర మంత్రి రామ్దాస్ అథవాలే, బాలీవుడ్ నటుడు చుంకీ పాండే ఈ అవార్డులను ప్రదానం చేశారు. ఈ కార్యక్రమంలో మంత్రులు పరిషోత్తం రూపాల, ఫగన్ సింగ్ కులస్తే పాల్గొన్నారు.
Exploring the different types of neurological disorders. Spotlight on Dr. Rao, the best neurosurgeon in Guntur in India, and Dr. Rao's hospital, the premier neurosurgery facility. Introduction. Neurological disorders affect the intricate network of the nervous system, causing a wide range of symptoms and challenges for those affected. We will also explore Dr. Rao's hospital, a renowned institution for neurosurgery in Guntur in India. Understanding neurological disorders. The human nervous system is a complex web of cells, nerves, and tissues that control our thoughts, movements, and bodily functions. Neurological disorders arise when there are abnormalities or damages to this intricate system. These disorders can manifest in various ways, impacting cognition, motor skills, sensations, and even autonomic functions. Types of neurological disorders. Stroke. A stroke occurs when blood supply to the brain is disrupted, leading to brain cell damage. It often results in paralysis, speech difficulties, or cognitive impairments. Epilepsy. Epilepsy is characterized by recurrent seizures caused by abnormal electrical activity in the brain. These seizures can vary in frequency and intensity. Parkinson's disease. Parkinson's is a progressive disorder that affects movement due to a lack of dopamine production in the brain. It commonly leads to tremors, stiffness, and difficulties with balance. Migraines. Migraines are severe headaches that can be accompanied by visual disturbances, nausea, and sensitivity to light or sound. They can significantly impact a person's quality of life. Amyotrophic lateral sclerosis, ALS. ALS, also known as Lou Gehrig's disease, is a progressive neurodegenerative disorder that affects nerve cells responsible for controlling voluntary muscle movements. It leads to muscle weakness, difficulty speaking and swallowing, and eventual paralysis. Traumatic brain injury, TBI. TBI occurs when there is a sudden impact or blow to the head, causing damage to the brain. It can result in various cognitive, sensory, and motor impairments, depending on the severity of the injury. Neuropathy. Neuropathy refers to damage or dysfunction of the nerves outside the brain and spinal cord. It can cause symptoms such as tingling, numbness, muscle weakness, and pain, often in the hands and feet. Cerebral palsy. Cerebral palsy is a group of disorders that affect movement, muscle tone, and posture. It occurs due to damage or abnormalities in the developing brain, often before or during birth. Individuals with cerebral palsy may have difficulties with coordination, balance, and fine motor skills. Brain tumors. Neurosurgeons play a crucial role in the diagnosis and treatment of brain tumors. Whether benign or malignant, these abnormal growths in the brain may require surgical intervention for removal or biopsy. Spinal disorders. Neurosurgeons are skilled in treating various spinal disorders such as herniated discs, spinal stenosis, and spinal deformities like scoliosis. Surgical procedures, such as spinal fusion or discectomy, may be performed to alleviate pain, stabilize the spine, or restore function. Hydrocephalus. This condition involves the accumulation of cerebrospinal fluid, CSF, in the brain, leading to increased pressure and potential brain damage. Neurosurgeons often employ surgical procedures, such as the placement of a shunt, to divert excess CSF and relieve pressure. Chiari malformation. Chiari malformation is a structural defect in which brain tissue extends into the spinal canal. Neurosurgical interventions, such as decompression surgery, may be performed to alleviate symptoms and restore normal cerebrospinal fluid flow. Trigeminal neuralgia. This condition is characterized by severe facial pain, often caused by irritation or compression of the trigeminal nerve. Neurosurgeons can perform procedures like microvascular decompression or stereotactic radiosurgery to alleviate pain and improve quality of life. Cranial nerve disorders. Neurosurgeons may treat various disorders affecting the cranial nerves, such as trigeminal neuralgia, mentioned earlier, facial nerve disorders, and vestibular schwannomas, also known as acoustic neuromas, that affect the vestibulocochlear nerve. Moyamoya disease. This rare cerebrovascular disorder is characterized by the narrowing or blockage of the arteries at the base of the brain, leading to reduced blood flow. Neurosurgical procedures, such as direct or indirect bypass surgeries, are performed to restore blood flow and prevent stroke. Skull-based tumors. Neurosurgeons specialize in the treatment of tumors located at the base of the skull, including pituitary adenoma, meningiomas, and chordomas. Surgical approaches, such as endoscopic endonasal surgery or craniotomy, may be employed to safely remove these tumors. Epilepsy surgery. In cases where medication fails to adequately control seizures, neurosurgeons can perform epilepsy surgery to remove or disconnect the specific brain areas causing seizures. These procedures aim to reduce seizure frequency or even achieve seizure freedom in certain individuals. Cerebrovascular malformations. Neurosurgeons are involved in treating various cerebrovascular malformations, including arteriovenous malformations, AVMs, cavernous malformations, and dural arteriovenous fistulas. Treatment options may include microsurgical resection, embolization, or radiosurgery. Lumbar disc herniation. Neurosurgeons often treat lumbar disc herniation, which occurs when the soft cushioning discs between the vertebrae and the lower back rupture or bulge. Surgical interventions like microdiscectomy or laminectomy may be performed to relieve pressure on the spinal nerves and alleviate pain. Spinal cord tumors. Neurosurgeons specialize in diagnosing and treating tumors that affect the spinal cord. Surgical procedures, such as tumor resection or spinal stabilization, are performed to remove or reduce the tumor's impact on spinal cord function. Degenerative spine conditions. Neurosurgeons frequently address degenerative spine conditions like spinal stenosis, degenerative disc disease, and spondylolisthesis. Surgical interventions, such as spinal fusion, laminectomy, or artificial disc replacement, may be performed to alleviate symptoms and stabilize the spine. Traumatic brain injuries, TBIs. Neurosurgeons are at the forefront of managing traumatic brain injuries, ranging from mild concussions to severe head trauma. Peripheral nerve surgery. Neurosurgeons also specialize in treating peripheral nerve conditions, including carpal tunnel syndrome, ulnar nerve entrapment, and peripheral nerve tumors. Surgical procedures like nerve decompression, transposition, or tumor excision may be performed to relieve nerve compression or address nerve-related issues. Epidural hematoma. An epidural hematoma occurs when there is bleeding between the skull and the protective covering of the brain, dura. Neurosurgeons often perform emergency surgical intervention to remove the clot and relieve pressure on the brain. Subarachnoid hemorrhage. Subarachnoid hemorrhage refers to bleeding in the space between the brain and the thin tissues that cover it. Neurosurgeons are involved in diagnosing and treating this emergency condition, which often requires urgent surgical intervention to control bleeding and prevent complications. This is a life-threatening emergency that necessitates immediate neurosurgical intervention to relieve pressure and prevent further damage to vital brain structures. Dr. Rao, the best neurosurgeon in Guntur in India. Dr. Rao is widely recognized as one of the foremost neurosurgeons in Guntur in India. With extensive experience and expertise, Dr. Rao has dedicated his career to providing exceptional care to patients with complex neurological conditions. His passion for neurosurgery, coupled with his commitment to staying updated with the latest advancements, has earned him a stellar reputation among peers and patients alike. Dr. Rao's Hospital, the premier neurosurgery facility. Dr. Rao's Hospital is a leading institution for neurosurgery in Guntur in India. Equipped with state-of-the-art technology and a team of highly skilled professionals, the hospital provides comprehensive care for various neurological disorders. From diagnostic assessments to advanced surgical interventions and post-operative rehabilitation, Dr. Rao's Hospital offers a multidisciplinary approach to ensure the best possible outcomes for patients. Conclusion: neurological disorders encompass a broad spectrum of conditions, each with its unique impact on the nervous system and overall well-being. Dr. Rao, a distinguished neurosurgeon in Guntur in India, and his renowned hospital, are at the forefront of providing expert care for patients with neurological disorders. Their dedication, expertise, and commitment to advancing neurosurgical treatments have made them invaluable assets to the medical community and sources of hope for countless individuals seeking neurological care. Thanks for watching.